So our practice is pretty eclectic, and our patients really appreciate that because we offer a lot of different types of modalities. So most of the practice is family-based, and so we see everything from newborns all the way to those in their elder years, and kind of everybody in between. But beyond that, the practice has been here for 5 years. I've been in practice for almost 12. And in that way, my practice has moved, ebbed and flowed a little bit depending on the type of patients that we've seen. For a long time, it's been a lot of hormone replacement, hormone balancing, menopausal, premenopausal women, men with hormone imbalances as well, testosterone problems, and then a lot of folks with thyroid dysfunction. So this is where we'll oftentimes move away from prescription medications and towards those alternative modalities. And those are things like acupuncture, prolotherapy, platelet therapy. We'll often also use supplementation, counseling, nutrition. And a lot of these, when they're used together, can give you much more improved outcomes for patients with a lot less side effects. So this is a model of your knee. Obviously the skin's been removed, but we can see down to the bonus structures where we're actually almost getting inside the joint. So this is actually your femur or your thigh bone. This is your shin bone. So you can see as the knee is bending, so you can get a good look at the menisci that are inside here. And if we turn to the back side of the knee, you can get a good view of the ligaments that are here in the knee. You got the collateral ligaments on the sides, and then you got the ACL and the MCL here inside of the joint itself. So today what we're going to do is we're going to actually, on the outside of course, we're going to clean a little bit of the area with some alcohol, and then I'm going to then use a topical spray to kind of use a coolant effect so that it actually numbs the skin so you don't feel a whole lot. And then using my needle, have you look away, I'll look away too, just kidding. And then we can actually insert the needles here, insert the fluid, kind of aiming down towards where your problem is around the ACL in the hopes that we can then try to build those new tissues. So we know supplementation can be a very effective way of trying to treat a number of different conditions throughout the body. The problem oftentimes is getting doses high enough that will actually have a downstream positive effect. So one good example is vitamin C. It's been well known for nearly a century that vitamin C is good at improving immune health. Well, oftentimes though, you got to get well above 5,000 milligrams. Well, most people who try to swallow 5,000 milligrams end up with some digestive upset. So this is where IV therapy comes into play. You can access one of the veins and actually add up to 100,000 milligrams of vitamin C. And because you're bypassing the GI tract altogether, it's not going to give you any digestive upset, and it'll kick in a lot faster because it's absorbed very quickly. And you can do that for a lot of different things, whether that's vitamins, minerals, and even sometimes you can use it for what's called chelation. This is a nice way to try and remove the different metals that aren't supposed to be in the body, and it helps you eliminate them in a safe and comfortable way. So here's an example of an acupuncture needle. It's about the width of a human hair, and we're going to put 4 different needles in today. 3 things can happen when you put the needle in. 1, which is the most common, you'll feel nothing, so small. Number 2 is you'll feel a little poke. It is a needle after all. And number 3 is you might feel a little bit of a sharp pain. It's really rare, but if it does happen, we'll just take it out and put another one. We oftentimes will marry acupuncture with either prolotherapy or PRP in addition to any other kind of modality we find is necessary to help people with their pain.